When administering a cleansing enema, follow these steps. Place the bedpan nearby or the commode near the bed. Open the enema supplies or kit. Attach the tubing to the enema pail or solution bag if necessary. Close the clamp on the tubing and fill the container with 500 to 1,000 milliliters of warm solution. Check the water temperature with a bath thermometer. It should be 105 degrees to 110 degrees Fahrenheit, 40 to 43 degrees centigrade, or lukewarm to minimize cramping. It is not safe to warm the solution in a microwave. Add Castile soap, or the soap solution used by your facility, to the fluid at this time if a soap suds enema has been prescribed. Squeeze gently to mix the soap. Hang the container on the IV pole. Holding the end of the tubing over a sink or waste can, open the clamp and slowly allow the tubing to prime with solution. When the tubing is filled, re-clamp it. Don clean, non-sterile gloves. Ask or assist the patient to turn to a left side-lying position with the right knee flexed. Do not administer the enema with the patient on the toilet. The curved rectal tubing can scrape the rectal wall. Place the waterproof pad under the patient's buttocks or hips. Drape the patient with the bath blanket, exposing only the buttocks and rectum. Depending on the patient's mobility status, place the bedpan flat on the bed, directly beneath the rectum, up against the patient's buttocks. If needed, lubricate the tip of the enema tubing generously. If necessary, lift the superior buttock to expose the anus. Slowly and gently insert the tip of the tubing approximately 7 to 10 centimeters or 3 to 4 inches into the rectum. Have the patient take slow, deep breaths as you complete this step. If the tube does not pass with ease, do not force it. Allow a small amount of fluid to infuse and then try again, inserting the tube slowly. Remove the container from the IV pole and hold it at the level of the patient's hips. Unclamp to begin instilling the solution. Slowly raise the level of the container so that it is 30 to 45 centimeters or 12 to 18 inches above the level of the hips. Adjust the pole and rehang the container. Continue a slow, steady installation of the enema solution. Continuously monitor the patient for pain or discomfort and ability to retain the solution. If the patient has difficulty retaining the solution, lower the container, stop the flow for 15 to 30 seconds, and then resume the procedure. When the correct amount of solution has been instilled, clamp the tubing and slowly remove it from the rectum. If there is stool on the tubing, wrap the end of the tubing in a disposable wipe or toilet tissue and dispose of it. Clean the rectal area, cover the patient, and instruct him to hold the enema solution for approximately 5 to 15 minutes. Be certain that the call light is within reach. Dispose of the enema supplies, or if they are reusable, clean and store them in an appropriate location in the patient's room. Remove your gloves and perform hand hygiene. When the patient needs to defecate, assist him onto the bedpan to the bedside commode or to the toilet. Perform hand hygiene and use clean procedure gloves as necessary. After the patient has defecated, clean the rectum and buttocks and remove the bedpan or assist the patient to bed. Inspect the stool for color, consistency, and quantity. Remove gloves, perform hand hygiene, and cover the patient. When you finish the procedure, remember the universal steps that apply after all procedures. For example, leave the patient in a safe, comfortable position with the call device in easy reach. For a pre-packaged enema, perform the same steps as for a cleansing enema: gloving, positioning, and so on, with the following differences. Open the package and remove the cap from the container. Clip the tip of the container if it does not have a hole in it. You may also need to add extra lubricant, even though the tip is pre-lubricated. To instill the solution, tilt the container slightly and slowly roll and squeeze the container until all of the solution is instilled. Withdraw the container tip from the rectum. Wipe the area with a disposable wipe or toilet tissue. Dispose of the empty container.
Sometimes there are special situations that you will encounter during the procedure. What if the patient is an infant or child? For infants, use 50 to 150 milliliters of solution. For toddlers, use 250 to 350 milliliters of solution. For school-age children, use 300 to 500 milliliters of solution. What if the patient has shortness of breath associated with a respiratory condition? Elevate the head of the bed very slightly. Avoid the semi-Fowler's position. What if the patient has poor sphincter control? Position the patient on the bedpan in a comfortable dorsal recumbent position.